cardiovascular disease remains the leading cause of death in the United States. For patients who've had an acute cardiac event, such as a heart attack or open heart surgery, or for patients who are living with a chronic cardiac condition, there's ample evidence that has shown that if patients participate in cardiac rehabilitation, not only are there less cardiac events, but there's an enormous benefit in terms of patients' quality of life. Unfortunately, despite these great statistics, only about 25% of patients who are eligible for cardiac rehab actually participate in the program. In our community, what we found is that this is largely due to lack of availability of programs. But more so, when you actually talk to the patients who do enroll in a program, you find that there's a dissatisfaction with the scope of education that people are getting in the traditional rehab programs. Seeing this need in the community, we at North Suffolk Cardiology decided to take matters into our own hands. With our partnership with Stony Brook Medicine, we are proud to be the first cardiology practice on Long Island to offer the Pritikin Intensive Cardiac Rehab Program. Unlike traditional cardiac rehabs, which largely focus on exercise, the Intensive Cardiac Rehab Program uses a three-pronged approach based on the Pritikin model that, in addition to exercise, focuses heavily on balanced nutrition and a healthy mindset.
So a traditional cardiac rehab program is exercise-based only, and it's a 36-visit program. And the intensive cardiac rehab program is 72 visits. And the patients not only get exercise, but they are also getting education.
The patient's journey begins with a visit with our cardiac nurse, who delves into the patient's history and helps formulate the initial goals and expectations of the program. From there, they meet with the exercise physiologist, who works with the patient to formalize an individualized exercise plan. Rather than giving patients pamphlets and written recipes, patients now have access to a live cooking demonstration with our registered dietitian, where she shows them how to bring healthy eating to life. Through one-on-one and group sessions with our licensed social worker, we focus on goal setting and stress reduction techniques such as deep breathing, healthy sleep, conflict resolution are taught to patients in real time. Through this equal focus on body, mind, and nutrition, patients are able to formulate a personalized playbook for long-lasting and meaningful lifestyle change.
Each of these staff members play a large role in our program. Besides their experience and education, I think the greatest asset is their personalities and enthusiasm. The greatest thing about intensive cardiac rehab is the sense that the patients get of having a cardiac rehab family here. Anyone can join a local gym and go exercise, but by coming here, the patients really establish relationships not only with the staff, but with each other. When you're talking to other patients, you can really get a feeling and empathy from somebody who has actually been there and experiencing what you're feeling. My goal for this ICR program in the future is to continue to grow, for the word to get out to the community about how great this program is. The goal for my patients is always to improve on their quality of life. We see patients with a decreased quality of life not able to participate in things that used to bring them joy. By participating in this program, we would love to see their quality of life increase and for them to go back to doing the things that they used to love to do.